Hi everybody, and welcome to another One History Help video with me, Ms. O'Neill. This is the final video in the little mini series I've done here on public health. So hopefully you're watching this after you've watched the medieval, the Renaissance and the industrial one. So you're all caught up to date with everything that's been going on in the history of public health. Just to remind you here so that we all have the same definition of what we're going to be talking about today. Remember, all public health measures are only ever put in place by a government, and those measures are put in place to essentially keep the population healthy. And in our last video that we did on industrial public health, we focused a lot on the idea of clean water and sewage systems. Today, in our modern public health video, we are finally going to be tackling the idea of the National Health Service. Not exclusively, that's not the only part of modern public health, but it is a very, very significant part indeed. Just like in the other videos, we're going to break down what exactly that looks like in these videos. So we're going to be covering these things right here. We're going to be taking a look at the hygiene of the population at this time, the cleanliness and how dirty, quote unquote, people were. We're going to link everything we're looking at in terms of public health to a specific disease. We're going to be looking at the role of hospitals, very important in modern public health. And also we're going to be looking at specific laws that are put in place. Just a reminder that what you can see on the screen here is not necessarily the order that we're going to discuss things, but it will be covered by the end of the video. So we're going to be looking at the role of hygiene, again, the cleanliness of people in the modern era. The specific disease we're going to use is actually COVID, the COVID-19 pandemic. More on that towards the end of the video. We are indeed going to be looking at the National Health Service in regards to hospitals, and importantly, we're going to be looking at the introduction of something called the welfare state, used by our government very, very early on in the 20th century. So let's get going. Now, for this, it feels kind of odd talking about the hygiene of people in the modern era, because the modern era is essentially the year 1900 up to the modern day. So I thought it would probably be most convenient for us and most useful for us to look at this from the perspective of the early 20th century, so early 1900s. Now, we already know that cleanliness is a factor in all of our time periods. This idea that people in the past were dirty and smelly is, generally speaking, a misconception, and that actually people did care about cleanliness and hygiene for their personal appearance. In the industrial era, we start to see that, yes, whilst cleanliness is associated with your social class, we are also seeing that cleanliness is given an aesthetic quality as well. So the idea of how, quote unquote, attractive you are is related to your personal hygiene as well. That obviously continues into the 20th century. And what we're starting to see in the 20th century, especially in the early 20th century as well, going into especially, I'm thinking 1920s kind of time, is this idea that products are being marketed very specifically towards women to improve their appearance. So things like makeup, for example. And unlike previously, like in the industrial era, a lot of these products that were marketed towards improving how you look in terms of your hygiene, cleanliness, and therefore your attractiveness, were very much marketed towards the middle and upper classes, whereas now we're starting to see a wider range of products coming out. And with that in mind, we're going to be getting the more luxurious end of aesthetic products, and we're also going to get a more, how can I put it, budget-friendly version of it as well. So now it's not just wealthy people who can make themselves look good, quote unquote, again, but it's becoming available to people with lower incomes as well. One of the tremendous benefits we have thinking about hygiene in the early 20th century is that everybody now understands about germs. Everybody understands this concept. We have gone past this concept of and belief of miasma and bad smell causing disease. We are well beyond this idea of the majority of the population believing that God sends illness as punishment for disease. We are now very firmly aware that dirty conditions and dirtiness in general is what is going to be causing disease. And that shows that this concept of cleanliness now is actually going beyond that attractive quality. For the wealthy, though, and like I said, I don't want to be misleading with what I said before, because to be clean is still incredibly easy if you're rich. For instance, like I said in the industrial video, this idea of having running water and proper toilets in your house is still something that the wealthy members of society would have experienced. For those in the lower income category, those who are working class, it is still incredibly difficult to get access to clean water, even in the early 1900s. You might have seen the industrial era video. I showed you a picture by a French artist called Gustave Doré, who visited London and did a drawing of what it looked like. Those kind of dwellings are still around in the early 1900s. So this idea of having a flushable toilet, for instance, in your house was still something that you would really, really have to be earning a lot of money to be able to afford. But what's important here is that people understand the idea that germs cause disease. And that is the key difference between cleanliness in the industrial era and cleanliness in the 20th century. I've said it before and I'm going to say it again. Only a government can put public health measures in place. So therefore, in every time period video that I've done on public health, we've had a look at what governance is like in that time period. We would have seen in the last video on industrial public health that there were significant changes that took place in terms of people's voting rights, which had a direct impact on the public health laws that the government put in place. We're going to see this continue into the modern era. Firstly, we get a new political party at the turn of the century, the Labour Party, one that you are all very familiar with. It's hard to believe that it hasn't been a part of our country for very long compared to something like the Conservative Party. But the Labour Party was created, like I said, at the turn of the 20th century to represent the rights of the working class, as is suggested in the word Labour. Now remember, we are talking about a significant proportion of our population being working class. Despite the fact that they were a new party, they definitely posed a threat to the likes of the Conservatives and the Liberals as well. We'll talk more about that in a little bit. In 1918, we get further changes to people's voting rights, where we have all men over the age of 21 and all women over the age of 30 being given the right to vote, regardless of how much they earn, regardless of if they own property or own land. That is the only stipulation, that you are a man or a woman who is not in prison, and you are over the age of 21 as a man and over 30 as a woman. It's later reduced to 21 for women as well in 1928 as well. Britain continues to be a constitutional monarchy. This is a dramatic change that takes place towards the end of the Renaissance era under the Stuart monarchs in our country, where we went from having absolute monarchs who made all of the decisions for us to constitutional monarchs who work with Parliament. Now, what we see there and why that is important is because over into the industrial era and very much into the modern era and thinking about today, our royal family now has very little to no say in the running of our country. Yes, it's more complicated than the very simple phrase I've just used with you there, but nonetheless, it is very, very important to see that we are seeing a huge change compared to what things were like in the medieval era, when kings and monarchs said, this is what I think and this is what is going to happen. Now, democracy is very much a cornerstone of our society here in Britain. However, even today, here in 2025, those people who are in Parliament still come from very privileged backgrounds. Not exclusively, that is changing. And also, we are starting to very gradually see diversity in representatives and members of Parliament in regards to gender identity, ethnicity and race, and sexuality as well. So more is yet to come in government in our country and how that's going to affect on the health opportunities that are available to us. As people's voting rights changed during the industrial era, so too did the government's approach to public health. In 1875, we finally got compulsory measures put in place that were designed to look after the health and state of the people. This then continues in the early 20th century with the creation of something known as the welfare state. Recognise this key term. It will be used in your exams. I've seen it come up before with AQA. The welfare state in Britain is a system where the government provides support to make sure that people's basic needs are met. Now, for the purpose of what we're talking about, we're mainly looking at this through the lens of healthcare and medicine. However, it does also overlap into education, housing, and financial help as well. We're going to see in the rest of this video now a few different things which come under the welfare state, starting with something in the early 1900s known as the liberal reforms, and then moving in to the National Health Service as well. Just a reminder, where we're going to be talking about reforms, this word reform, I talked about it in our video on industrial public health. Reform means change, i.e. being different to before. If in any exam question, be it in medicine or any other component that you study, you are asked about the idea of reform, then you have to compare it to what things were like before. That is what that word is designed for you to do. Likewise, if they ask about improvement or progress or change or reform, any of those words require you to talk about how things are different to the way they were before. So we're going to see the welfare state as a significant reform to the government's approach to healthcare in this country. We're going to now talk very briefly about why is it that the government made change at this time. That is the top skill of a historian, incidentally. Being able to say, why did change happen when it did? Why is it at this time specifically that changes are taking place? That's the top skill of any historian. One of the factors that introduced the idea of liberal reforms, specifically in 1906, as we're going to discuss very shortly, or changes to healthcare in general, is a conflict known as the Boer War, which was taking place between the British in South Africa and the indigenous peoples, the Zulus. Now, in the Boer War, a huge number of British men volunteered to go to fight. However, a large number of those people who volunteered were not allowed to go because they were medically unfit for service. This was ringing alarm bells for the government because whilst, yes, we're 14 years away from it at this stage, they knew that the Boer War was not the only conflict that Britain was destined to be in. I'm not saying they could predict the future. However, if you've ever studied the causes of the First World War, you will know by 1900, nations around the world, particularly in Europe, are building up their countries ready to fight in a significant conflict. Granted, in 1900, they're not doing it on a huge scale, but it will be built over time. So our government knew that if they were going to have a fighting force that was fit for service, they needed to do something about the condition of people's health. In the Industrial Revolution video, I talked about the Chadwick Report of 1842 influencing the government. We get further reports that take place in the late 1800s and early 1900s by Charles Booth and Sebum Rowntree. They take place in London and York. So Booth does his study into the lives of the poor in London and Rowntree does his in York. And their studies, although they were done in completely different parts of the country, both essentially come up with the same conclusion. And that is that the poor are just too poor to be able to look after themselves. And I don't mean that in a patronising sense. I mean that in terms of they are not earning enough money to be able to afford the basic necessities of people's lives. This is where we start to see the concept of the poverty line come in. That idea that there is a set amount of money, a line, if you will, of money where people earn. And if you earn below that line, then you are living in such a state of poverty that you are going to be finding it difficult to feed your family, to clothe your family, to provide shelter for your family as well. And they found that 30% of people in these towns and cities were living in that level of poverty. Even still, we're looking at what? Chadwick does his report in 1842. We see changes made in 1875, and even still into the late 1800s and early 1900s, we are still seeing people living in abject poverty. I've talked about them a few times, but in 1906, we get a change in government in our country. The Conservative Party had been in charge for quite some time up until this point. But in 1906, the Liberal Party were voted into power because they promised that they would improve the lives of the poor. Now, if I was being a bit cynical and thinking about what I have learned about politics around this time, and I talked to you previously about how the Labour Party was a new party in the early 1900s and they were proving very popular amongst the working classes very quickly. There is evidence to suggest that those people that were running for government and trying to get votes in the Liberal Party essentially, I don't want to say they stole the ideas of the Labour Party, because obviously I have to be very careful not to communicate my own political opinions. But let's just say they took inspiration from the ideas that the Labour Party were having. And so therefore they were voted into power. Now, this is important because, remember, we are talking about a time where the working class make up the largest percentage of the voting population. So if the Liberals want to stay in power, they have to be true to their word. So if they come to power promising the poor people, the labouring people, that they are going to make changes to their lives, they need to do it. Otherwise, they're going to see themselves voted out of power. And so from 1906, we see the beginnings of what are called the liberal reforms. Remember, reform means change, different to before. And the liberal reforms mark the beginning of the welfare state in this country. As you can see from the diagram, the reforms are designed to help the most vulnerable people in society. Children, the elderly, the sick, and the unemployed. And what I'm going to do with you now is I'm going to go through what the government does, what the Liberal government does under their reforms to help each of these different categories. We're going to be starting very shortly with children, but I just wanted to remind you or just make you aware of the fact that many of the Liberal reforms that we are going to talk through are still in existence today here in 2025 at the time that I am recording this video. So let's go through them. First of all, in 1906, one of the very first things that the Liberal government introduces is free school meals. Now, one of the things that we haven't really been looking at in our videos because it's not part of our study is access to education. Towards the late industrial era, the laws changed, which stipulated that basically all children had to go to school. And this stopped them from working out in the factories and so on and so forth as well. So with that in mind, they went to school and they were fed at school as well. Free school meals still exists in our society today as well. To what I'm understanding, I believe all children in infant school, so in primary school and infant school, all receive a free meal. All receive a free meal at lunchtime. And then from the junior school onwards, they can choose to bring in their food from home from there. We also get medical inspections in schools in 1907. This is where doctors and nurses would go around to schools and give pupils compulsory medical checks. And any treatment that was needed was to be paid for by the parent. So we're still not at the point yet where we're getting like free prescriptions for young people or anything like that. That does change in 1912. In 1912, the government starts to fund many of those prescription charges from there. But essentially, under the School Medical Inspections Act, doctors and nurses went into schools periodically to check and make sure that the children were in a decent state of health. In 1908, we see the passing of the Children's Act, where children become protected persons in our society. It always shocks me, especially now that I'm a mom as well, it always shocks me that that wasn't the case previously, that children weren't seen as different from adults at all. Children become protected persons, which means that their parents could be prosecuted for cruelty against them. Now, you've only got to be aware of characters in Dickens novels like Oliver Twist, for example, to know about how frequently children were mistreated during the industrial era. Likewise, under the Children's Act, children under the age of 14 who had broken the law could no longer be sent to an adult's prison. So yeah, unbelievably, before this point, if a child committed a crime, they would go to the same prison as an adult. The Children's Act also stated that children were no longer allowed in pubs and that shopkeepers were not allowed to sell cigarettes to any child under the age of 16. Again, another example of laws which are still in place in this country today as well. So if you, for instance, you are asked to explain the significance of the liberal reforms, remember when it comes to explaining significance, you've got to talk about how things have changed from before and the impact it has on the future as well. The liberal reforms related to the elderly also relate to an act that is still very much in place today as well. In 1908, they introduced the Pensions Act, which gave weekly pensions from government funds to help the elderly as they left the workplace. In the industrial era, there was no support for people when they were too old to work. Generally speaking, unless you came from a very, very wealthy background, as soon as your body got to a stage that you could not work anymore, it is quite likely that you would have found yourself in the workhouse. And essentially, you would have died there as well. So this pension gives them a set amount of money to be able to essentially survive each week. And everyone at this stage over the age of 70 was eligible for this state pension, this government funded pension. And we're going to talk a little bit later on in the liberal reform section here about where that money actually came from as well. So something else that still exists today is the Pensions Act of 1908. We're going to look at the sick and the unemployed together in this next one because there's a lot of crossover we're going to see between these different groups and some of the acts that were brought in. Starting off with something that is still a significant feature of the way our country is run today. It's called the National Insurance Act. Those of you who are watching this video who have either turned 16 or are going to be turning 16 soon, you will have had your national insurance card come in the post to you. Okay, it's a very, very important card because it means that, just like it says here, when you start working, once you start earning over a certain amount of money, and I'm being intentionally vague here because the amount of money, like the kind of entry level money changes constantly. But when you earn over a certain amount of money, part of your money is taken as national insurance money. This was introduced back in 1911 and 1912. The National Insurance Act was almost like, and it is almost like, an insurance policy, where essentially workers could insure themselves against sickness and draw money from the National Insurance Scheme if they fell ill and were unable to work. And this was then extended to help prevent poverty resulting from unemployment, to give workers money whilst they were looking for a job. We would refer to it today as job seekers allowance. Back at this time, it was called the dole, D-O-L-E, the dole. Then, when you had a job, you would then pay into the national insurance as part of your wages. At this time, part of this national insurance money is used to pay for pensions. Nowadays, it's slightly different. Nowadays, pension contributions, both from the state and people-specific employers, and there are also private pensions that you can take out. But let's just kind of stay focused on this time here. So national insurance was when people had an amount taken from their wages to go into this huge pot of money to be able to help people when they became unable to work. And so essentially, if, like, let's say, for instance, that I was a worker back in this time, back in the early 1900s, and part of my wages were going towards this. And then, unfortunately, due to maybe an accident that I'd had, I was unable to go to work anymore. And so what would happen is the government would pay me money. Granted, don't get too excited. It is not a lot of money. It's kind of like basic survival level money, so that I wouldn't end up in poverty. Then, when I would return to work, I would then start paying back into the national insurance again. So I'm not charged for dipping into the national insurance pot or anything like that. It is there because I pay into it already. And again, we still have this in place today. The National Insurance Act still very much exists today as well. In terms of the unemployed, well, like I said, part of the National Insurance Act was to make sure that those who were unemployed had money whilst they were actively seeking a job. And that's the important part here. You needed to show that you were actually looking for a job. You couldn't just say, oh, I still don't have a job, I haven't got a job yet. You would have to be able to prove it. Much the same today as well. In 1909, we see the creation of something called a labour exchange. We would call it, pretty sure they're still called this, we would call it a job centre today. Most towns and even some villages will have a job centre in it, where essentially workers, those people who were looking for work, the unemployed, would go to a labour exchange or a job centre and look to see what jobs were available. And that was to stop them from having to travel from place to place to place looking for work. So essentially it was just like one place that you would need to go to be able to find a job. And nowadays our job centres do tremendous things in terms of matching people up to careers and so on, and providing support to people who are indeed seeking a job. So again, great examples here of long-term significance and long-term impact from the welfare state and the liberal reforms of the early 1900s. Finally, we are moving in to National Health Service territory. Finally, we're moving into the NHS. But we're not there just yet. We're very, very close though. Thanks to the guy you can see, not the soldier who's holding up the mug, but the caricature of the man who is on the mug right here. His name is William Beveridge, and you've got a little pun of his name down the bottom here as well. William Beveridge, who in 1942 wrote what is called the Beveridge Report. This is exactly 100 years after Edwin Chadwick wrote his report into the living conditions of the poor. And shockingly, William Beveridge and the Beveridge Report, which was written to do exactly that, to look into the living conditions of the poor, even though it was 100 years later, Beveridge is still finding the same problems that Edwin Chadwick was. Despite the fact 100 years, an entire century has passed, he is still finding the same problems. His report was able to identify 5 giants that were ruining the lives of the poor: want, squalor, disease, idleness, and ignorance. Out of those words, ones that you might want explaining, squalor is dirt, so dirty living conditions. Want is essentially not having enough money. Disease is pretty self-explanatory. Idleness and ignorance. Now, I've seen different readings of this, and I have mainly interpreted it from the perspective of the idleness and the ignorance of the government. So the idea that our government are being too lazy and unwilling to make changes that are going to help the poor. Remember, he's making this report after all of those liberal reforms I've just been talking through with you. And also the ignorance. Remember, members of parliament are made up, especially at this time, of people from privileged backgrounds. So Beveridge identifies these 5 giants that are basically stopping the poor from living decent lives, even on a basic level. And so his suggestion was that the government needed to set up a system which looked after people, and this is a direct quote from Beveridge, from the cradle to the grave, from the moment they are born to the moment they die. The government needs to support people from those 2 distinct moments and every moment in between as well. His ideas that he outlined in his report would overhaul the national insurance system. I'm not saying that he would get rid of it, not at all. What he would do is he would improve on it. And alongside that, he makes the suggestion of a free national health service. So this is not the NHS being created, but it is the NHS being suggested for the first time. Now, the picture you can see here is taken from the front of the Daily Mirror newspaper at this time in 1942. The Daily Mirror has always been a tabloid newspaper, read predominantly by members of the working class. And as we can see, this picture is very, very much supportive of Beveridge and his ideas. And of course it would be, because these are the people who are going to benefit the most from it. Notice as well that, as you can see from the picture, this is still very much at the time when the Second World War is going on, 1942. We're right in the thick of it at this stage here. War would have started in 39. We know it ends in 1945. Okay, so 1942, right in the thick of the Second World War. So like I said, his idea, his Beveridge report, suggests the idea of a national health service. The NHS today is huge in terms of just how many different areas, facets, elements it has. The diagram that you can see just here just gives us a couple of ideas. But actually, there are hundreds of different elements to the National Health Service. And what I'm going to talk about here now with you, talking about the NHS actually being introduced, is based on what we would consider a very, very basic form of what we have today. But one thing I will say very, very quickly, and I'm going to refer to this again later on in the video too, and that is essentially the NHS has not been properly updated since its creation in the 1940s. To use a phrase, the National Health Service is not fit for purpose. By that I mean, it was created at a time when it matched the needs of our society. But our society is different now. I think, and again, I'm being very careful here with my political opinions as best I can, but as someone who has a chronic illness and receives treatment regularly from the NHS for that, I think it is one of the greatest things to ever happen to our society. And it pains me that it is so underfunded. It almost needs building up again from the ground. It needs completely, and I don't mean that physically, I mean like in terms of sitting down and thinking it through. We need to go back to basics, look at our country as a society and think, what do we need? What are the needs of this country? And the people here in the 21st century as well, because our needs are very different now. Not completely, don't get me wrong. We're still having children and we're still needing x-rays and things like that, don't get me wrong. But we are rapidly becoming more and more aware of health, both be it physical and mental as well. And also we have the issue, and I say that in quote marks, that we are living longer. You know, this National Health Service was built for people with a much lower life expectancy than we have. And I'm sure in some way you've experienced this in your own families or in your own communities. People's health complications only increase the older they get. And yet our National Health Service is still based around people with a much, much lower life expectancy. Anyway, I'm going to get off my soapbox now. Let's talk more about the NHS actually starting up. The individual who was given the responsibility of actually starting the National Health Service is Aneurin Bevan, also referred to as Nye Bevan as well. When World War II comes to an end, there's a general election and the Labour Party are voted in. Aneurin Bevan is a member of the Labour Party, but he is not the Prime Minister. A gentleman called Clement Attlee was the Prime Minister at this time. Nye Bevan was put in charge of creating the National Health Service. And he had a very hard time putting it together, despite the fact that many poor people liked the idea. Despite that, there were many people who were opposed to it. Under the National Health Service, the 3,000 hospitals that already existed in our country would come under the control of the government. Now, the people who ran these hospitals, we talked about this in the Industrial Revolution video as well, that most hospitals are either run by charities at this time or by wealthy individuals. And these people who ran the hospitals did not like the fact that their power to run their hospitals as they wanted to was being taken away from them. A lot of people were also angry at the fact that this was going to cost a huge amount of money. And they're not wrong. Okay, they are not wrong at all. You think the National Health Service is expensive nowadays? It always has been. And one of the things that compounded this problem was that in the same year that Bevan is introduced the National Health Service, we start to see the collapse of the British Empire. This is the year where the jewel in the crown of the empire, India, declares its independence. And that is a huge cut-off of wealth from Britain, from the government. Also, keep in mind, we're rebuilding a country at this time. This is in the aftermath of the Second World War. Unlike World War I, which was mainly fought out on battlefields in other countries, World War II was a war on the front doorsteps of the people of this country, thanks to the Blitz and the bombing campaigns of the Nazis. We had a country to rebuild as well. People are like, how on earth can we justify spending this level of money on a National Health Service? Now, Bevan was no idiot. Bevan himself came from how can I put it? I wouldn't say he came from a working class background, but he certainly came from a less privileged background than a lot of MPs at this time. And he knew just how vital this was going to be long term. So Bevan says, yes, this is going to be expensive, but he argued that the nation had to afford it. Something had to be done, that they had to be able to afford it, and they could afford it as well. Now, the could afford it part, I don't know how much I believe that, but the idea that, there's no going back here, we need to do this, is very, very key. It probably doesn't surprise you to know, or again, hopefully you're watching this for revision purposes, so you'll know this anyway, that doctors did not like the idea of a National Health Service. Up until 1948, no matter what social class you belonged to, if you wanted to see a doctor, you had to be able to pay for it. And you would have to be able to pay a lot of money as well. Doctors were angry because they saw the NHS and being taken over by the government as a way of stopping them from earning money. In January 1948, the British Medical Journal, or the British Medical Association, the association, forgive me, the journal is the publication from the association. The British Medical Association did a survey of doctors in England in Britain. And they said, how willing would you be to work for the National Health Service? 90% of doctors said, not a chance, not interested in working for the NHS whatsoever. Bevan knew that he needed doctors. You can't run the NHS without doctors. And obviously other healthcare professionals as well, but we're just focused on doctors for the moment. He knew that he would need to compromise with them to get them on board. So he met with them regularly and they came to an agreement where Bevan said that all doctors would be guaranteed a wage from the British government, and on top of that, they would be given time to be able to see and treat patients privately and charge for their services just like they have done. Now, the question that might be running through your mind is, why on earth would anybody choose to pay for healthcare when they could get it for free? Well, because at this time in 1948, there's still a lot of snobbery around. And to be able to say to someone that you pay for your medical care is a real flex. That's kind of showing off your wealth as such. Nowadays, it's still the case. So, for instance, the consultant that I see for my chronic illness sees me under the National Health Service, but I also know that he treats patients privately as well. One of the main reasons a lot of people choose nowadays to go privately as opposed to under the NHS is because of waiting times, and that you can be seen a lot quicker if you are able to pay for your medical care. Back to 1948 though, Bevan makes this compromise with the doctors, and then just before the doors open on the National Health Service on the oh my gosh, I'm going to get the day wrong, oh my goodness, I just thought of it then, but it's July 1948. Oh, I'm pained that I can't remember the day. It's in the early, it's less than 10. I was going to say 7th, but it's not 7th, but it's around that time. But before it opens its doors in July 1948, the British Medical Association conduct another survey on asking the same question of doctors. How willing would you be to work for the National Health Service? And now 90% of them have said, yes, I will work for the NHS. Thanks to the shrewd politics and negotiations of Aneurin Bevan. Looking at the National Health Service today, a lot of what exists in the National Health Service from a public health standpoint, like you can see on these posters here, is all about trying to prevent illness. It's not about trying to treat illness, it's about trying to prevent it happening in the first place. So for example, like on the far left-hand side, trying to prevent illnesses caused by obesity and poor diets. From the middle one, trying to prevent illnesses caused through smoking and vaping as well. And also making people aware of the fact that antibiotic resistance is very much a real thing. And don't kick off and don't expect a doctor to prescribe you something like an antibiotic unless it is absolutely necessary. So nowadays, our National Health Service is more about prevention than it is treatment. That isn't to say you can't get treatment on the NHS, not at all. However, significant efforts now are gone to make sure that illness can be prevented. So, for example, one of the things that is very much a part of the NHS, and you may well have experienced yourself, is national vaccination programs. Things like the HPV jab. Things like, for instance, offering things like the flu vaccine to people as well. All of these things demonstrate this idea that nowadays the NHS is really focused on trying to prevent illness as opposed to treat it. Because like I said before, we don't have the space. Okay, we don't have the space. So it kind of makes sense really, isn't it? That if you try and stop the problems with health happening in the first place, then you won't have the issues further down the line of trying to treat people and saying, I can't treat you yet, I don't have enough space for you. So the NHS is still very much here today. In terms of, especially, I know I keep talking about it, but it's so true. There's so much long-term impact here. Explain the significance of the National Health Service. The National Health Service changes tons from what things are like before, no longer having to pay for medical care. However, if you look at the long-term impact of the NHS, it needs rapid change made to it to be fit for purpose because the society that we are living in now today. The final thing we're going to talk about then is the COVID-19 pandemic. Now, obviously, depending on when you're watching this video, you will have varying memories as to what the COVID pandemic was like. I do not have that issue. I remember the COVID pandemic incredibly clearly. And it often surprises people when I teach them to say, you are allowed to talk about COVID in your exam. Now, I can't imagine. Now, I don't want to say definitely not because, who knows what might happen. I can't imagine them asking a specific question on the COVID-19 pandemic, but they might ask about public health in the 21st century. Likewise, you could talk about it during the factors question. So if you're asked, for instance, factors on public health, maybe. And I just wanted to describe to you just some of the things that you can see on the screen here. Again, you might recognize some of them depending on how strong your memory is of what the pandemic was like and how these things fit into public health. And there's a couple of more things on there as well. So a lot of the measures that were put in place during the COVID pandemic are defined as public health measures. The most extreme one was lockdown. So the idea that everybody had to remain in their homes. Obviously, there were exceptions to that, but I'm just being very basic about it for the purposes of this video here. So lockdown was an example of a public health measure. Likewise, social distancing as well. You might even see it in some places like town centres here and there. You'll see these stickers on the floor asking you to keep 2 meters apart from people at all times. That's social distancing. If you speak to family members or maybe people who are a bit older than you who might remember it, they may well remembering having to queue to get into shops and supermarkets to be able to adhere to social distancing. Face masks as well. I remember when we came back to school after the COVID pandemic and students having to wear face masks around the school and also at times in classrooms as well. So face masks to prevent the spread of infection as well. You can see it down there in the on the far right hand side there. Hands, face, space, washing people's hands, hand sanitizing stations being around everywhere as well. Also part of public health measures too. The space part there referring to the social distancing. We also had people when we were in lockdown being allowed in what's known as bubbles. And by that, I mean, naturally, you would spend lockdown with your immediate family, but you could extend that in terms of your bubble to, I think, one other person, possibly one or two other people. So for instance, I know people who had children at that time. I didn't. I wasn't a mom during that time. It was just me. But I know people, for instance, who were able to extend from their immediate family to include possibly grandparents as well. So people, for instance, who had come round and provide help with childcare, for example. So we also had that as well. We have the widespread vaccination program, and it's still going to be, I think, one of the things I've been most impressed by in my entire life was the almost military level of organization of this vaccination program. I've actually lost count of how many COVID jabs I've had now. I'm actually due to have one again in a couple of weeks' time, and we're here in 2025, like 5 years later, and I'm still getting those COVID jabs as well. But that widespread vaccination program was also an example of a public health measure. The lateral flow testing as well, the availability of those made through the National Health Service. For those of you who don't know, the lateral flow test is what you can see in this image just here. Okay, in this picture just here. And essentially you would have to, you would be given almost like a really long cotton bud. Okay, like with a little cotton bud at the end and like a long stick almost. And you would have to open your mouth up nice and wide and put the cotton swab in, and you'd have to kind of go around like where your tonsils were, basically. And it was it was horrible. Even thinking about it makes you want to gag, really. But then also once you've done that, you would have to kind of swirl it around your nostrils as well. You'd have a special bit of fluid, and you dip that, and what you would do is you dip the cotton bud into the fluid, and then you would drip the fluid onto the bit that says the letter S just there in this little part just here. So you drop the fluid on and you would leave it. And if after, I forget how long you had to leave it for now, but the longer you could leave it for, the better. But essentially, a single line like this was good, no COVID. A double line like that was bad, and that meant you had COVID. You can still get them today. You have to pay for them now. But at the time, the National Health Service gave them out for free. Now, again, the way that these lateral flow tests were used differed depending on how deep into the pandemic we were. I remember when we were having children come back into school, everybody had to take a lateral flow test and report their findings once a week. And of course, as soon as you were seen to have COVID, you would not be allowed into school. If somebody at school came down with COVID symptoms, that entire year group would be sent home. Now, different schools would have done things differently. I'm just talking about what we did in the place where I was working during that time. And because of the whole idea of social distancing and so forth, we kept all of our year groups together in the same place. So there was very little interaction across the year groups. So, for instance, I remember this happening. One of our students in year 8 fell unwell. And with that in mind, all year 8 students had to work from home. Sorry, not work from home, learn from home. So we went to doing online lessons for those students there. That's obviously a very specific thing that we did, but that was an extension of the lateral flow testing as well. And then, especially during lockdown, we get the COVID briefings being delivered on television from the likes of our Prime Minister at the time, Boris Johnson, the Deputy Prime Minister, oh my God, I'd suddenly forgotten his name. I've remembered it. Rishi Sunak, who then later went on to become Prime Minister himself, and also various health advisors. Chris Whitty is one of the most famous ones from that time as well. And essentially, these COVID briefings were used to update people on how many people were dying from the pandemic, when the likelihood would be that lockdown measures would be adjusted, and so on and so forth as well. It was a way of basically keeping people in touch, considering that you couldn't leave your home. So yes, the COVID pandemic and the measures that were put in place are examples of public health measures in the modern era. And that brings not only this video, but the video series on public health to an end. I really hope you found this useful. If you need any advice or any guidance, please reach out to me. You can contact me through here, or you can always find me at One History Help, all one word, on Instagram, and you can send me a DM through there, and I'm happy to help you with anything that you may need. Thank you so much for staying through the video here with me and all of the other videos as well, and I look forward to seeing you again soon for another One History Help video.